Welcome to Solid. I'm Dr. Bob Good. I'm an internal medicine physician in Central Illinois, past president of the ACOI, and I want to welcome everybody to our Solid program tonight. Just a little advertisement. Next month, the third Thursday of the month, we will, as always, at the same time, we'll be having a discussion on how to interview and how to get letters of recommendations and those types of things for the future. Tonight, we've got a very important topic, and that is to talk about the boards. So of all the things we do in the first and second year, it all prepares us for the next step, and that is taking those boards, which we need for graduation and to move on. So I'm going to start by introducing Kim Peck. Kim is a director of academic affairs at Michigan State University. She's been one of our speakers before in talking about the various types of boards that are out there and how you should take them. And Kim, I'm going to turn the program over to you, and thank you very much for joining us tonight.
Well, thank you very much for having me.
What I'm going to plan on doing is about 25 minutes, and then I'll have Dr. Layher do his thing for another 25 minutes, and then we'll have a 10-minute time for questions. So
okay,
turn it over to you. Thank you very much again for coming.
Let me just make sure I am, oops, I get my screen set up correctly. There we go. Now I gotta find you. Okay, do you see the proper screen? Okay.
Yes.
Yeah, yes.
Thank you. I just want to make sure you weren't seeing the presenters mode. So I'll check that. Okay. Well, good evening, everyone. I am Kim Peck. I am from MSU Michigan State College of Osteopathic Medicine. And I'm going to talk a little bit tonight about COMLEX and USMLE. And I know that's always a big question, as whether you should take USMLE, what's the difference, and maybe going over some myths or some things that people think about it that I don't think are in reality quite true. But at the end, I'll be happy to answer any questions. I actually do I'm in charge of academic advising as well as all the career advising at the college. So we can go either directions with this with your questions if you'd like. So the first thing is just the things we'll talk about. I'm going to do a little comparison of the exams. I'll talk about the COMLEX blueprint and the USMLE content breakdown. The big question I always hear is, should I take USMLE? And the change to pass-fail scoring system and some of the impacts we've seen so far, even though we haven't officially gone through the first match with the pass-fail, but what some of the trends and things that we're seeing. Okay, so the first thing when I'm talking to my students about COMLEX and USMLE is realizing there really is a difference. And sometimes the students say, well, I'm taking one test, I can take them both. But I think it's important to distinguish between the two and the differences between the two. As you know, the COMLEX is the exam that all DOs are required to take, and the USMLE is required for your MD colleagues, but optional for DOs. I'm sure you all know that. They both consist of 3 levels, and as of 2022, the level 1 and step 1 went to pass-fail, which created some interesting impacts on level 2 and step 2 for students, where maybe there was less pressure for level 1, step 1, but now we're pushing the pressure further back as you're getting into your audition rotations, which causes another dilemma. But I'll go into that in a little bit. The structure of both of them, there's 352 multiple choice questions divided into 8 blocks for the COMLEX. I wrote down the breaks and what that looks like. And the USMLE has 280 questions divided into 7 blocks. Basically, you are going to have more questions with the COMLEX, and that's something to keep in mind if timing is an issue and the amount of time that you want to pace yourself as you're preparing and making sure you're fluid with your time. The question types. So I've always heard the difference in the question types. Been doing this for 12 years now, and it still remains the same. The description I get from students and for looking at the exam is the question style on the COMLEX tends to ask more vague questions and ask you to pick the most correct answer. And with the USMLE, the questions are very clear and straightforward. They're asking you to answer it. It may be a rigorous question, but it's pretty straightforward. You either know it or you don't. Level 1 and step 1, the passing scores is the passing threshold was 400. And that threshold is still the same for a pass. And then for USMLE, the threshold actually increased by 2 points to 196 for a pass. Some interesting thing on the stats here, the trending for the first time pass rates, and gotta put on my glasses because my print is a little small. So it's been interesting. The most recent year, 22-23, where we have national numbers, the first time pass rate, so first attempt, is 90.6% nationally. That was a decrease from 21-22, which was 92.2%. And then again, it decreased from that subsequent year, which was 93.7 in 2020 and 2021. So there was a lot going on in those years. We had a pandemic, it switched to pass fail. So there's a lot of confounding factors, and I don't think anyone can say with 100% certainty why this happened. But I do think, again, the pandemic had something to do with it. Many people were in virtual courses for a bit. I also think there was a psychological effect of pass fail, and people maybe didn't think it had to work quite so hard, and didn't think it was going to be as difficult to get to a passing threshold as it is. And again, just experience and my opinion on that. There's no evidence to support that, but I really do believe that dealing with my students, that was some of the factors that were involved. The same thing if you look at USMLE. I only have 2 years of data here, but we had a 94% pass rate in 2021. And then we had an 89% pass rate for DOs for 2022. So it's interesting about the USMLE is it's self-selected. So not everyone has to take it. And so generally who I see selecting out of that are students who, one, just certainly know that they don't need it with the type of specialty or programs they're applying to, or the students who maybe aren't testing as well and they just opt out knowing that they're not reaching a safe threshold in order to take that official attempt. But it is interesting that this is a self-selected audience that we have here, and we see such kind of a dramatic decrease here. And again, my opinion, and again, there's no evidence to back this up, it's just my experience with talking to students, is a little bit of an underestimation of how much it takes to pass these exams. Even though they demonstrate minimal competency, they're certainly still difficult exams, and you have to adequately prepare to pass them. And since then, I feel like the subsequent classes are learning the lesson and seeing what happened the year prior, and they are taking it a little bit more seriously. And then I brought in level 2, step 2, because it's now very relevant. Even if you're still haven't taken level 1, step 1, there's some things to think about here. And pass rate is a 400, and the pass rate for the USMLE is a 214. Again, we see some of the same instances of the decrease in scores from the year. Again, we start with a 96.54 in 2021. We go to a 95.06 in 21-22, and then a 94%, 94.5 in 22-23. Now, historically, there is a higher pass rate for level 2 and step 2 all around for everyone, but we still see that decrease happening here. And again, not sure exactly why that's happening, but it is occurring. So sometimes when you're preparing, it's nice to see what happened the year before, and you can learn from history and what's happening with past students who've taken it. Oops. Okay. So just a little bit about the blueprint. I hope you've all seen the blueprint. If you're going to take these exams, you should certainly take the time to go on the NBME website and look at their blueprint. And you can see the breakdown of everything here. There's going to be some slight changes if you're going to be taking it from May 7th, 2024 on. Just some slight changes. This number 1, osteopathic principles, practice, and manipulative treatment will go up to a 12%. And the number 4, the practice-based learning and improvement in osteopathic medical practice will increase as well. So just some minor changes, but I always encourage my students to know the makeup of the exam, go on the blueprint, click on these hyperlinks, and really know what this exam's about and familiarize yourself with the content. So as you're spending time preparing, you can strategize, and if your time is short or if you have plenty of time, you can choose your high yield topics first and then work down to the lower yield to maximize your score. But again, hopefully everyone has time to study all of the topics, but like I said, it's always wise to be familiar with the exam that you're taking. Another thing I like to tell my students, I know everybody loves UWorld, and I get it. Like, UWorld is great. They have great explanations. It's a great learning tool. I wouldn't ever discourage anyone from using it. However, I really do encourage my students to use some COMLEX-oriented question bank, because you will need that practice with the different question style and getting your speed together, your fluidity of reading those types of questions. They're very different. If you probably have all looked at them, you can see there's a very different question style and approach to these. But also, there are pure and integrated items on COMLEX, and it's not just, sometimes people are like, oh, I'm going to take USMLE, I'm going to take a week and study some OMM, and then I'm going to take COMLEX. Well, OMM is actually, a pretty high yield topic and on the COMLEX, but there's also a lot of integrated osteopathic principles and practices integrated into other questions. So I really encourage students, yes, you can use UWorld, but find some COMLEX-oriented question bank to use as well, just to get your practice and to get your score up. I've worked with, for example, a really high achieving student, and our school has our students take the COMSA. He didn't do very well on it, and I was surprised because he, normally higher performance trends to higher COMSA scores, and he hadn't done a single COMLEX-oriented question. So he took a week, really spent a lot of time on a ComBank or a ComQuest, and his score went up tremendously. And I wasn't worried that it wasn't. I think he just wasn't used to the style, and just some exposure like that to these topics and the question style really was beneficial to them. And I know we have ComBank and ComQuest are kind of the big ones right now. There's different people who like the different products. It's kind of like a 50-50. I don't know if either of them live up to the UWorld reputation, but these are the two that most students use, and it seems to be doing a sufficient job in preparing them for the question types and the content that they'll see. Okay, and again, just want you to be aware of the breakdown in the ranges in the USMLE, and to make sure while you're creating your study plan that you take these different percentages into account and how much time that you're spending preparing for each of these. And for example, if you have behavioral health and the nervous systems is a weak topic for you, maybe you spend a little bit more time on that. So there's a lot of different things like that that you can actually be preparing now for your exam, and where to focus your time. Okay, so the question, should I take USMLE? So these are the questions I commonly hear when I ask my students. It's required by a specialty, or very much in a specialty, or by program or programs that you're interested in. Somebody told me to, a peer usually. You're undecided on your specialty, so you want to keep your options open because you don't know how important it's going to be for whatever specialty you choose in the future. You want to match in a geographic area where USMLE is prevalent. You want to pursue a fellowship, and it may be required to keep your options open and maximize chances of matching into a competitive specialty. So some of these are valid. The someone told you to, probably not a valid reason. You really want to do your due diligence on whether it's right for you. So if you are undecided and you don't know where you want to go, you're a high, you have really solid academic performance, then maybe that is a good idea for you to take it. And a lot of the programs that you're interested in, you're doing your research on, are requiring the programs that you want to apply to require a USMLE. I really like my students to try making their decisions based on fact as much as possible. And I know that's not always possible if you're at a place where you don't know your specialty. So we take the facts that we do have and make the best decision for you. I never have a problem with someone taking USMLE. I think it's each student's decision, but I do have a problem when students will go forward with it, putting themselves at risk and having a failure on their application, which really can be harmful. Another thing to think of for those of you who may struggle academically is you are taking on two large standardized exams that you're preparing for versus one where you could possibly have much stronger performance in one versus trying to spread your efforts in two of them. And again, this won't apply to everyone, so you've got to really take your own situation into account. Some people can take, it's not a problem, not that it doesn't, use effort, but it's not a problem to take the two, and others, it really is an effort, and sometimes the results are not what we want. So we certainly don't want to take a risk in taking the USMLE if there's a chance that you won't pass it. Now, the good thing is for USMLE, there's a lot of practice assessments that are actually quite accurate in providing us some indications of where you are in your confidence in passing this exam. The NBME self-assessments, and the higher you go are the more recent NBME assessments. So I definitely think I would definitely recommend, if you are going to pursue taking the USMLE, that you take these NBME assessments and watch your progress and make sure that you're in a solid scoring range before you take that. I've had a lot of students who are right on the edge and they're trying to figure out to take it or not. And it's a tricky thing. So just something to keep in mind. You don't want to take it and fail and then say you pass your COMLEX. Then it calls into question your competency in taking exams. Which one is it? Even for the osteopathic program directors, they can see a fail there. It'd be like, well, is this person going to be someone who's going to struggle with passing licensing exams? So, like I said, you must prepare for 2 structurally distinct exams. You must achieve a passing score in 2 board exams versus 1, and the effort and the pressure that takes, as well as the financial outlay that you make for paying for 2 of these exams. Will you benefit from it? And all scores are reported on your residency application. Now, some of my students will argue with me and say that I don't need to, but if you look at ARIS guidelines and the NRMP about providing programs with any accurate, relevant information, that includes all licensing exams taken. I've actually brought this question to NRMP and what they thought about this, and they did say that a failed licensing exam, even if it wasn't required and the student take it, should be on the application. So something to keep in mind. Okay, so what do you do from here? You're not sure, maybe some of you are confident, I'm going to take this, but maybe you're not sure. So my advice would be to seek out advice from your medical school advisors and your faculty. I will acknowledge there's a regional differences in acceptance of COMLEX and among specialties and programs. The good thing is that all of this information is available and with different tools. And if you have some idea of what geographic region you're looking for or some specialties, even if it's a pool of specialties, there are places that your advisor can point you to help give you some factual information about what the outlook looks for you. Match data for students who took USMLE versus those who did not. Most medical schools will keep data on their students' match, and that can be really helpful, especially if you are matching in a geographic area where a lot of your peers and alumni have matched. And then USMLE data from students who had similar pre-clerkship performance. We do a lot of data analysis in my program, and one of the highest indicators consistently is academic performance in pre-clerkship is highly correlated with COMLEX and USMLE performance. So in addition to your advisors, there's a lot of national resources that are available. Residency Explorer is a really good tool to explore programs, to see how many DOs are in those programs. You can create comparisons by checking in different programs, and it provides a lot of really good information. If your institute participates in the Texas STAR program, it's not just Texas programs. It is a program started by a medical school in Texas, hence the name, but they will, this database gives a lot of competitiveness data. You can enter your own profile in this database and get some statistics on your competitiveness for these programs. And of course, the program website. If you are ever wondering, does this program take USMLE? Does it take COMLEX? You can look at the program website. Sometimes I tell my students to look on FRIDA. It is the residency and fellowship database. I always think this is a nice place to start to kind of break it down. So maybe I am going to look for internal medicine programs in Michigan. I can see them all, and a lot of the programs in FRIDA have expanded information where they will tell you if they take COMLEX and if they require USMLE, and often they will even provide you the minimum scores you need to be considered for their program. So as you're preparing for these exams, especially level 2 and step 2, which I mentioned, that will be really important. So again, all of these resources can be really helpful, and just explore and get to know them. Okay, so the data that you can utilize in your decision making, grades in your individual courses. I know for us, all 12 years, the pre-clerkship academic performance is highly correlated with those board exams. If you take any of the COMATs, we do give our students the FBS. There is some correlation there. The COMSAs, we did a lot of correlation with COMSAs, and there are certain numbers where on your COMSAs that does signify, that you're in a strong place to pass that exam. Your cubing performance, watching the trends on your cubic performance, making sure it's going up, and really using the data that those QBanks provide is really helpful. Both, I know ComBank, because we have that at our school, has a lot of the statistics, and you can break down by time, see how you're doing more recently with things. So if you aren't quite sure how to analyze it, to talk to your advisors or your faculty who work with you on board preparation. They can walk you through these things, help you look at the data, and give you an idea of all of these metrics and what this looks like for you, of what your passing range is, or if you're on COMLEX level 2, what scores you're trending toward. And then prior performance and standardized exams. This is another correlation that we found is pretty solid. If you've had, how did you do in your MCAT? Did you get a solid score on your first attempt, or did you have to take it multiple times before you got that solid score? If you had to take it multiple times, then that's a little bit of something to think about. Or even back to your ACT and SAT, we see a lot of the same things. The good thing is a lot of people learn from their MCAT and what they would do differently after going through that experience. So hopefully you've had a learning experience from taking your MCAT, and you can apply it to your first licensing exams. And of course, as everyone knows, there's test anxiety, and everybody has a certain amount of anxiety or stress about exams, but when it becomes debilitating and it impacts your performance, you definitely do want to talk to a professional who can walk you through that. And really quick, common questions, we can go back to this later. Can I skip step 1 and just take step 2? That's a common question coming up now. If I fail an exam, do I have to report it? Yes. And does studying for step 1 cover studying for level 1? I think I went over that a little bit as well. So I will end here because I think my time is up.
Thank you, Kim. I very much appreciate your time, and we'll have time for questions. By the way, those of you who want to ask questions for Kim or for Dr. Layher, please send a note to Kara Kearns, and she'll be addressing those questions with the speakers following. So I next want to introduce Dr. Josh Layher, who's a practicing internal medicine physician in Idaho, and he has multiple times done this presentation very excellently. Josh serves on a committee for residents and students at the ACOI. So Josh, take it away.
Hello, can you guys hear me okay?
Yes, sir.
Okay, so yeah, thank you for the introduction, and I want to appreciate everyone coming out and listening. So passing the boards, most important things, the very first step towards success in any occupation is to become interested in it, and that's from Dr. Osler, who kind of started the whole concept of graduate medical education. So we got a poll question here. You guys can raise your hands or just kind of put in the chat. Which board exam do you guys currently preparing for? USMLE, COMLEX, or both? So I'm seeing a lot of both, COMLEX, both. Kind of as, kind of reviewed in our last lecture. You do have to make a decision on how you want to approach it, but my personal recommendation from, doing residency and being on some committees and seeing my friends go on and do fellowships, I'd recommend you guys do both. True, false, COMLEX and USMLE have no correlation to each other's score. And put that in the chat, whatever you think it is, true or false. A lot of false. That's very correct. There is a ton of correlation between how you do on one impacts the other. And being a future resident, there's research on everything. So resources that improve medical board licensing exam. Ultimately, the patients who did the best on the exams had very correlated scores. So if you do proper preparation for one, you'll do well on the other one as well. There's a lot of overlap. Definitely there's different ways in how they ask these questions, but at the end of the day, the heart of it is still medical knowledge. And the goal is, improving that so we can do a good care for our patients when we're at the bedside. This specific test showed that people preparing for both, average mean score was a 633 on the COMLEX, compared to the people who only prepared for COMLEX only got a 553. And that could be in terms of resources and question banks that people utilize, and we'll kind of go through that. So pathway to success. So it all starts with coursework. If you're doing well in your courses, you're going to do well on these exams. Additional resources, I'm definitely a fan of study groups. One, it's more social. You have the support of somebody who may know something better and they can help teach you. Also, gives you the opportunity to teach somebody else, which improves your retention and your performance. I'm a big proponent of people incorporating a review book early. The benefit of using this review book is you can incorporate it into your studies and add notes to it, and you'll be familiar with it. If you start busting out a review book in the final month or 3 months of your studying and preparation for these board exams, no matter what level you're at, taking level 1, 2, or you're already a resident in the future, it's not going to be helpful because now you're trying to understand what's in these review books, and it's just going to make it more complicated. Also a big proponent of question bank. The importance of a question bank is testing. If you don't test yourself, you're not going to really identify your deficiencies. And if you're not identifying those, you're not going to really improve. And then strong proponent of using a tutor, using that PGY2 if you're a 1 or I'm sorry, OMS2 or OMS3. As you're going through, they've already been through where you're at. They can give you a lot of advice. They also know how to prepare for those exams while you're doing your coursework for your courses. So lean on the people who have been there before. Year 2, kind of the same pathway. Coursework is still extremely important. You do need to go to your lectures. You do need to be listening to them, taking notes, participating. Again, review book is even more important. Question bank, even more important during year 2. Study groups are still important. And if you've done well and you have the opportunity being a tutor for others, that's going to, again, teaching somebody else really proves you know what you're talking about. If you're not able to teach it, it's going to be very difficult to apply it to either exam, random questions where you're picking the best answer. Tutoring is a very big boost to also your residency applications, but again, your retention. Question bank you intend to use. Anybody intend to use any of these question banks? UWorld, ComBank, ComQuest, Kaplan, EMBOS, Board Vitals. I'll give you my opinion once we get some answers. Okay, EMBOS, UWorld, TrueLearn, that's the new one. I haven't heard of that one. EMBOS, UWorld, ComBank, ComQuest, UWorld. So from my experience, UWorld is tried and true. It's tried and true even when you're a resident in internal medicine. Very robust question explanations typically. So I do think UWorld's a good resource even for your coursework. I do want to drive home the importance of using a ComBank or ComQuest for the OMM specific questions, and also the style. Question style is very important. If you're not exposed and practicing these questions for the osteopathic side, it's going to be a challenge getting these questions. And not every question involves OMM, but somehow your performance and knowledge of OMM does impact your outcome pretty highly. And also it just makes you a better future physician when you're treating patients on the clinicals. So definitely don't sell that stuff short. does anybody currently participate in a study group, use a tutor, or was a tutor? Oh, we got triple yeses, yes. I definitely, during my PG or OMSN 1 and 2, I did study groups for anatomy, very helpful, used the tutor as well. It was kind of like the, map before any of these courses. You kind of had an outline of what to do and how to approach it. So just made me personally a lot of coursework a lot better. And then, being friends with some of these more senior students were helpful when it came for residency applications. And, we still stay in contact, all these years later. So it's just good to build your social network of future physicians. You can get free consults out of it. So year 3, again, kind of the same idea, except now we're on the floors. I definitely recommend review book, whether it be specifically for the next board exam, but also for your specific rotation exams. There's quite a few of them. I liked some of the more question-based ones. And then there's Step Up to Medicine was a big popular one, Step Up to the Boards. Again, question bank, I have to drive home testing. Testing is extremely important. If you're not testing, you're not going to know what you're missing. And again, the rotation-specific review books, be a tutor, utilize a tutor, all these are important. So ultimately, the keys to passing these board exams, it really comes down to 3 steps, I believe. You have to test yourself, you got to review these questions, review what you're getting wrong, and then you have to study it. If you're not repeating the cycle on a, every other day or weekly basis, you're going to be missing an opportunity and you may be spinning your wheels. The test is where it all comes together. If you're currently preparing for exams and afterwards you're thinking, hey, I knew this, I just didn't apply it well, that's an example that you're just not testing yourself well enough, you're not exposing yourself to how questions are being asked and being able to apply what you already know. Review, my recommendation is it should probably take you twice as long to review the test as it took you to take the test. Of course, as you get more questions right, that's going to be shifting to where you'll spend more time on testing, less on reviewing. And then the study aspect. Again, apply it to the things you're missing. You don't need to keep studying things you already know. And we'll go through some strategies on how to study properly. So keys for passing the boards. This is next slide is going to have the journal article, but the main gist of it is, spacing repetitions. The concept of studying hard for an exam for hours the day before or a couple days before leads to a poor performance and usually a lot of test anxiety and stress. If you follow the concept of space repetitions, that means you might be covering a topic for 15 minutes, half an hour, and then you're covering that again maybe the next day, end of the week, maybe 2 weeks later. It has shown in multiple studies that you're going to be resulting in faster learning and better retention over the long term. And then the other benefit is the more you do these spaced repetitions, usually the studying is going to be going faster and you're going to be retaining it with a lot more ease. So they compared, again, what do you do leading up to the 48 hours before, and people who crammed all their studying in always did worse. So again, spacing out your repetitions, study before lectures, study after lectures to consolidate that information, and then plan to test yourself later in the week and see where you stand and what you still retain. So study, so predictors, charting successful study habits. Tons of commercial resources, but at the end of the day, no specific resource is better than another. What's actually used is being using the resources throughout your step 1 studying and step 2 studying so that you can incorporate that as you're learning in parallel with all of your coursework already. You don't want to be, again, learning new language or new details at the last minute in the final couple months when you take these exams. It's better to incorporate it with your study in parallel with the coursework and tie it together with the question banks. question banks all the time. So again, predictors of USMLE step 1 outcomes, starting successful study habits, study coursework, review book with it from the beginning, and then test yourself, that 3-step process. This is kind of an example of how you could plan your studying for overcoming that curve, that spaced repetition. So, you know, you prepare before the lecture, read ahead, maybe you skim 15, 30 minutes of it, take notes during it. At the end of the day, consolidate what you know. Week later, maybe you're starting to test yourself. Months later, you're testing yourself again. And it just drives home that retention, the consolidation of all that information. So here's another study, correlation, what led to successful step 1 scores. So the strongest correlation of all people's performance over many students and many years at this specific medical school was ultimately practice test score. So that's your COMSAs that was discussed earlier. And then your coursework grades, that was the next highest correlation. And then the third most relevant was number of practice questions. A lot of people ask how many practice questions I should be doing. When I was a medical student, the school and from my friends, what we could correlate was, if you had to put a number to it, probably say 4,000 or more questions. And that includes all places that you could do these questions. So your coursework quizzes, the preclinical exams that you were doing, and then any of the additional studying you were doing in your question bank. That usually means sometimes you got to use multiple question banks or you go through them multiple times. If you are going to go through them multiple times, I always recommend you reset it so that you can see your new percent correct range, and hopefully it's trending upward. Again, the more you question or do the testing, the more likely you're going to identify your weaknesses, and you'll be hopefully addressing those in your review sessions. One thing that didn't correlate really at all was how many hours a day you studied, which goes back to the idea of, spaced repetition. If you're studying efficiently and well, it doesn't matter how many hours you spend. You could spend 5 hours every evening, but if it's poor and unproductive, it doesn't matter. For my friends who did the best on these exams, it was actually some of the people who had families, because they were very structured in their how much time they could spend studying. They could only dedicate maybe 2 to 3 hours in the evening, and then they, were a parent. They had to go and do things with their kids and other things, and it just made them much more focused and productive. And they usually did very well. So approach medical school as a job, put in the time, and also at the same token, don't burn yourself out because it's a very long road. So examples of testing effects, again, this is focused on health education, very in line with medical school. So ultimately, your level of testing does need to be difficult. If you are simply rereading your notes and retesting yourself without a lot of depth, then you're going to be, again, wasting a lot of time. Repeated studying can improve the recall in the short term, meaning, you're going to burn through the hour or two before an exam, quickly reread, repeat stuff to you. You get this confidence that you know what you're talking about. But when you show up for the exam, you don't have it as concrete as you think, because you're using these notes as kind of a crutch and just repeating what you were looking at. The testing forces you to know and consolidate that information and apply it, and the spaced repetition helps with that long-term memory, so you can apply it, for your board exams, and more importantly, when you're down at doing clinical work on the floor. And so this is another article, talks about the importance of testing. Again, I have to really drive that home. No such thing as doing too many questions, as long as you're reviewing them and applying the information. So again, another article, factors predictive of performance on USMLE Step 1, do commercial study aids improve scores? And so ultimately, again, the preclinical grades have the strongest association. How well you do in your coursework does matter. And then ultimately incorporating a QBank, and they incorporated the UWorld, and it did ultimately improve Step 1 scores. Other study aids, multiple practice exams, and more importantly, delaying the exam does not specifically change your performance. So pick a deadline, prepare, and stick to that commitment. So you're not burning your holiday time during the summer, you know, taking these exams late into the clinical time. Take the time that the school prepares and allows you to have, and, you know, use these months to prepare. So 6 types of test taking errors. Definitely use this QR code, make it a favorite. The tons of benefits on this one. So common errors, misreading the direction. So maybe you're taking these questions and they're always tricky, pick the best answer, but maybe there could be more than one, or you're not putting things in the correct order. Careless errors are ultimately you get your test back and you're reviewing it, you immediately knew the mistake you made and you could have gotten a couple more points. Concept errors are ultimately you don't understand the properties of the principles to get the actual answer. Maybe it could be a mistake on understanding physiology reactions. The concept is ultimately can be bridged by using a tutor and study groups and teaching others what you know or identifying what you don't know. Application errors are kind of the same idea. You understand a concept, but when it came to the actual specific patient, maybe you're not getting it right. And maybe this could be a common scenario would be some of these infectious disease questions. You know, a common cause of a problem for pneumonia is one thing when you're 60, it's quite different when you're 12. You understand the different bacteria, you understand they're all present, but there are certain things that are going to be more common in adults compared to kids, and that would be, you know, an example of that application error. Test procedure errors, that's ultimately just running out of time. Missing questions, skipping questions, not completing a problem to its full completion, changing test answers after you thought you started to have some self-doubt. And then study errors are ultimately not preparing for the material correctly. So maybe you didn't know an exam was coming up, it was a surprise, or maybe you studied the wrong parts of the anatomy test or the biochemistry. Ultimately, again, a tutor and a study group really helps with these study errors. So think of the medical information as a picture frame. You're never going to cover the entire picture frame to the center, but every time you keep studying, you want to get closer to the center of that material and closer to the mastery of it. So again, that's University of Minnesota. They talk about the 6 types of test taking errors. QR code is there. Definitely use that as a way when you're reviewing these board test questions you're doing. You got to understand the mistakes you're making so you can bridge those gaps. So another important thing about retrieval, so another article, test enhanced learning. Ultimately, using retrieval practice helps students learn. So again, that comes back to testing and reviewing. It doesn't matter how you do these questions. You could do multiple choice, you can do short answer, you can do fill in the blank, but you do need to test yourself and you do need to make it, again, challenging. If it's too easy, you're going to breeze through it, and you're going to have this overconfidence that you know the concepts, but when it comes to the test time, you're going to do poorly. So do testing. If I had to recommend, as you get more advanced, the best one is really just a blank question. So fill in the blank is very challenging. And if you can answer those questions that you prepared as a fill in the blank, then you know it, you can teach it, and you'll be able to have in-depth conversations about it. Multiple choice, we can usually get it narrowed down to maybe 2, and then you're down to 50-50. And if you're, again, doing that on only a lot of your exams and you're not getting the results, I would escalate the difficulty and try to do your own created fill in the blank. And then that usually does a lot better. We're getting another from Vanderbilt University talking about strategies for improving your test performance and retrieval. Other tips or keys for passing the boards and also just being a good medical student. I think organization is extremely important. Over here on the right side is kind of an example of how I set up my notes for as a resident. So I broke it down by topics. Whenever I came across a pearl or a question, I would kind of put it in one of these sections. The benefit of it is with at least iOS devices at the time. Whenever I searched, I could have all my notes be synced and look up anything real time. If you're reading a lot of PDFs on iPads, I like PDF Expert. And then this other app is called Margin Note. That's here in the center. It really helps you make mind maps, a bunch of other ways to really make quick flashcards if you're into that. It's just another really robust study aid that I thought was really helpful for me. And so what do we do the week of the test? Ultimately, it all starts with getting good sleep. If you are stressed out, you're not going to do well, and that's going to show up on the exam. So you've done all the hard work, you've done the preparation, you've possibly spent over 2 years preparing for these. Anything you do in that final week, it's not going to move the needle too much. So don't set yourself up for poor performance by having poor sleep. Do the simple things, confirm the location, maybe even drive by ahead of time, get an idea of where parking is. You don't want to have anything stressful occur on the day of the exam, and you definitely don't want to show up late for the exam. During this final week, continue to do your questions in review, but don't necessarily stress about the results. You're not taking the board exam yet, that's later in the week. So just continue practicing the questions kind of more as an endurance and keep up your stamina for these long exams. The day before the test, I recommend no studying. It's not going to move the needle. You're probably more likely to harm yourself and stress yourself out. You've already done all the hard work. And again, if you're doing testing, reviewing, studying, and doing the spaced repetitions, one day is not going to change your score in a positive way. It's more likely it could make you do poorly if you bring too much stress to that exam. Additional links here. So Ambrose, UWorld, Pathoma, Online MedEd. There's a podcast that was recommended to me by some students when I was a resident. Divine Intervention and Podcast. Again, Tulane has a USMLE 1 prep guide. And then the last link is also the bottom right UR code. There was a physician who was big in GME, and he went through all the details about prior to these pass-fail exams, what really were we kind of measuring? What was the difference between somebody who got a high score of 280 on the old exam for somebody who got a passing exam? And sometimes the difference between those people was maybe only 20 questions. So again, these are in the past were bell curved a little bit, and you're ultimately the stress of this is that your performance on these exams does not fully represent who you are, you know, as a budding physician or a future physician. They're an objective way to make measurements, and they represent a step for pass-fail and licensing, but at the end of the day, they are not the end-all be-all on how your performance is as a medical student or as a physician. So just keep always trying to improve. Again, this was a little bit older, but these are some of the top resources for step 1 previously, First Aid, UWorld, Boards, and beyond. I think Pathoma is becoming a lot more popular. And then for step 2, again, UWorld, very popular. Online MedEd, as you guys pointed out. Anarchy is a great thing for flashcards if you like those. Ultimately, just pick your resources. I'd probably limit it to 2 question banks and maybe 1 or 2 additional review book resources, depending on what you like, and try to keep the same method. I wouldn't be going through a new review book every month. I'd kind of stick to what you pick and add notes to it, and then again, do your test, review, and study. So in summary, ultimately, your coursework does matter. You need to do well on those, and it's going to also impact how well you do on your rotations and get those coveted letters so you can get that desirable residency spot. Definitely get a review book, incorporate it early into your coursework, do a question bank on a regular basis, you know, daily or every other day. It could be as little as 10 questions a day. It's going to add up so you can get to, you know, 4,000, 5,000 plus. When you're reviewing, keep a record of all these questions. You need to know your mistakes and you need to review them. And that's how you're going to retest and improve those mistakes. Little quote here, too few residents emerge from training, thankful for the opportunity to practice in a fascinating and intellectually challenging field. Instead, many believe the world owes them something for what they've been through. And that was a quote from a physician in 1988. So just a funny quote because everyone always feels they've had it rougher than the people before them. If there's any questions, go ahead and throw them in the chat or turn off your mute so we can do our best to answer them.
Thank you, Josh. Appreciate your presentation. Outstanding information there. So again, please place your questions in the chat to Kara, and then we'll get those on to your speakers. I think Kara has sent a few questions on to Kim. Kim, have you got those questions?
Yeah, let's see here. One of the questions is about UWorld for COMLEX prep. I wasn't referring to the COMLEX prep section. I was talking about UWorld for USMLE. So I have there's nothing wrong with COMLEX prep in UWorld. So I didn't mean anything by that. It's only been around for about 2 test cycles for me. So I really don't have enough input to give an opinion about that, if it's a good resource or not. So I didn't mean anything about the COMLEX prep section. And the other one is, I've been getting a lot of questions from my students. Can they just take USMLE step 2 because it's scored, and USMLE step 1 is maybe irrelevant? And I'm really not, I know you're not going to like this answer. I'm really not finding any change in program behaviors. Again, this is the first cycle where we have pass-fail for step and level 1 and scored for step 2 and level 2, but I still see the same programs requiring both step 1 and step 2 if they are requiring it. We can continue, and we will continue to watch and see if there's any program behavior, but I don't anticipate that happening quickly, if it happens at all. So my advice would be, if you plan to take it, you'd be best to take both step 1 and 2.
Josh, do you have an opinion to that?
Yeah, I would
well?
definitely take both. Fellowships, they're going to want to see these, and there are too many things down the road to just not do it. So you're already prepared for one, again, prepare for the other. Question style is different, but the material is very similar, so you'll do well on both if you're going to do well on one.
And for those 3rd and 4th year students or 3rd year students at least, who are listening in, I would suspect that the study habits that you outlined for step 1 applies to step 2 and for the ongoing shelf exams, etc. Is that a shake of the head? Okay, yeah. I mean, I think all of what you guys are both talking about is just developing competency and developing it over time, rather than cramming, which really doesn't develop competency at all. I think that's what Josh's, well, your studies were demonstrating. Any other questions out there, Kara, that have come up?
None that have come up right now.
Okay. So I want to point out to everybody, we're just about the end of our time here. This has been videotaped tonight, and if you want to use this in your local chapters as to show to the rest of your group, other people that's missed this, because I think this is very important information for all first year students to learn this, and these are valuable. I don't get this information anyplace else by ACOI. I don't see this being presented in other locations. So be able to use this video, and you can contact Kara to get the link to the video. Go ahead, Kara, with a question.
Yeah, we just got a question. Are both COMLEX 1 and 2 MCQ, or are they just case presentations? And then, or is there a clinical portion with a patient interaction?
So both questions, or both, all the exams, board exams, are all usually a clinical question that's kind of a background story, and then followed with multiple choice questions. I think the physical exam portion is abandoned on both sides, I believe now. So ultimately, it's all, book test questions. I would say on average, the osteopathic questions are shorter, and that's what makes people feel them being more vague. And the USMLE style questions are usually more robust. and you're given sometimes too much information is what feedback I would say. So that's important. You got to prepare for both and have a question bank, I think, for both to do that exposure so you're comfortable.
Kim, you got anything to add to that?
No, I would agree with all of that.
Okay. Any other questions out there? Well, this has been an outstanding evening. Thank you very much to both speakers. Very helpful information. For the students, please give us feedback. Kara will be sending out a questionnaire to you all, and we get better by trying to learn what your needs are and how we can better serve you. So please complete the information. So I want to thank everybody tonight. It's 8 o'clock, and I promise to start on time and end on time. So that's what we're going to do. I hope everybody has a great January, and please stay warm.